My name is Michael Erossy. I'm a staff surgeon at the Cleveland Clinic in the Department of Orthopaedic Surgery. What is total knee replacement surgery? So a total knee replacement in its simplest terms is taking a patient with end-stage knee arthritis that has essentially failed all other non-surgical treatment options, taking their arthritic bone, removing it, and filling it with metal and plastic. What happens during a total knee replacement? So the general process for total knee replacement is we make a midline incision on the front of your knee. We dissect down to the extensor mechanism, so your quadriceps tendon, the patella tendon, to your knee capsule. So all of our joints have a capsule tissue around them. We open that up and expose the knee joint and essentially make some very precise cuts on the femur bone, cuts on the tibia bone, putting a metal component on the femur, metal component on the tibia bone, and there's a plastic insert that goes in between there. And in patients with very severe arthritis underneath their kneecap, we resurface that as well with a button. And at Cleveland Clinic, almost all of us are using a robotic platform of some kind to enhance our ability to be precise with the balance and cuts that we make on the knee to give you the most sort of normal and anatomic feeling knee replacement when we're all done. What conditions and symptoms are treated with a knee replacement? For a number of different reasons, there's a chronic inflammatory process going on within the joint that damages the cartilage over time. Eventually, you get to a stage where that normal cartilage is not functioning appropriately, and you get to quote-unquote bone-on-bone arthritis, where that cartilage is completely non-functional and the joint is very irritated, very inflamed, and that causes a lot of pain that patients feel with knee arthritis. Patients with severe arthritis in their knees will typically present with a long history of progressively worsening pain in the knee, which is primarily number one. The joints can get very stiff, the range of motion is decreased, pain with eventually nearly all activities of their day, walking, doing stairs, walking on uneven ground, sort of a constant pain, particularly with any weight-bearing activity. What does recovery look like after a total knee replacement? I like to tell patients that recovery after a joint replacement is all of a year. There's some soreness and things to kind of work through immediately after the surgery, but we're really good about keeping patients' pain under control so that you can start bending your knee, you're up walking right away, right after surgery, and just gently working on your motion, icing your knee down to help with the swelling and pain. Physical therapy after a total knee replacement is incredibly important to get patients up, moving around safely on a walker immediately after the surgery, and working on the range of motion right away from time zero as soon as they get out of the operating room until we see them back for the post-operative visits. After about 6 weeks, patients typically start to feel really, really good. 3 to 4 months, most patients are back to work, back to doing most of the activities that they weren't able to do before. What are the risks of a total knee replacement? The major risks after a total knee replacement would be infection, blood clots, hardware problems, periprosthetic fracture or fracture on the hardware, and in very rare cases, a nerve or blood vessel. What is the prognosis after a total knee replacement? So, one of the big reasons that I love doing what I do is modern knee replacements are some of the most successful procedures in modern medicine. 90+% of patients are essentially pain-free once they're fully recovered from their knee replacement.